So migraine is what most people would consider to be a sick headache, and they often don't actually recognise that the attacks that they're getting are migraine. But if you're an otherwise fit, healthy person and you get episodes of headache that last for part of a day up to 3 days, and with those headaches light bothers you, you feel a bit sick, and you're struggling to carry out your usual daily activities, that's migraine. An aura is a set of neurological symptoms that precede the headache or sometimes can occur on their own without a headache. And most people would describe those as starting with a little blob, white blob in front of their vision that gradually spreads across their field of vision. And if you ask them to draw it, they'll go like this. And it's moving across over about 20 minutes across their field of vision, and then it disappears. There may or may not then be a gap before the onset of the sick headache. But if you have an aura, you know about it. It's very typical for migraine to worsen in the perimenopause, and the majority of people, of women who seek help for migraine, are just approaching menopause. So we notice that they link progressively with menopause symptoms, so that if you have migraine, you are more likely to experience hot flushes and night sweats as you approach the menopause. So we need to try to manage both of those conditions. There is no reason to be concerned about safety of HRT because of migraine. All we're doing is using physiological doses, meaning doses the same as your body would produce by itself, of the same type of hormones that your own body would be producing. So there are no concerns. It's just a question of getting the HRT levels and doses right to control the hot flushes. That will manage your migraine also. The best type of HRT to take for migraine is the type of HRT that we would recommend for everybody who's using HRT, which is the body-identical HRT using estrogen, ideally in a patch or gel form, so it's going straight into the bloodstream, providing nice, stable levels at stable doses. The second hormone, progesterone, we would also want to be body identical because that can also be helpful for migraine in that it helps promote better sleep and has a calming effect on the brain.